organizing committee of OncoQuest along with Ashni, Advait, and Guru Raviram today. So OncoQuest is basically a result of collaboration between three organizations, that is Nurture Oncology, EdSpectrum, and Medicine. So all of these encourage education and collaboration in STEM students and research and subjects of medical discipline so that students can be one step ahead of the normal curricula, especially undergraduate students. So I would like you all to meet the organizers of OncoQuest, that is Nurture Oncology, co-founded by me and Advait Krishna Surendran. Then EdSpectrum, founded by Ashni Kesnam and GV Raviram. And then we have Medusine, which is founded by Dr. Raghunandan. Now over to Advait.
Hello everyone, I am Advait. And Nurture Oncology was started by Mansi and me as an initiative to promote undergraduate research in the field of oncology. Oncology, being considered as a super specialty, was something quite difficult for undergraduate students to get to in terms of research. So we have completed 2 research projects as of now, and we are
the vision to evolve AI into healthcare. Today we have 300 plus medical professionals with us, and if you're passionate into looking more about AI and healthcare, please join these channels. Over to you, Advait.
On behalf of Dr. Raghunandan, who is the founder of Medicine. Medicine is a YouTube channel which provides undergraduate students with lectures on a periodic basis.
MBBS publishers for being our sponsors and being a part of OncoQuest. Unstop is a very leading platform that bridges gap between the students and professionals and organizations by providing through the Sorry, one second. So Unstop is a leading platform that bridges the gap between students, professionals, and organizations by providing access to career-based opportunities. And next we have HeadSuit. It is founded by myself and Raviram. So we provide HIMS systems with AI-driven toolkits, which is useful for doctors to streamline clinical workflows and to enhance patient care. And next we have CBS Publishers. They are a well-respected name in medical and healthcare education. They have been instrumental in providing high-quality education resources to support the medical students and researchers to get the knowledge, basically. So a big shout out to all the sponsors in helping us throughout the journey. Over to you, Mansi.
So, welcome, Dr. Avneesh. And Dr. Avneesh will share insights on the future of AI in healthcare and the role of interdisciplinary collaboration and innovation on cancer care. So, he's been certified by American Board of AI in Medicine. He's also been the panelist at G20 India at Rishikesh. He's also been featured in Forbes and Times Square's New York, and he's the top voice on LinkedIn USA. He has co-authored more than 15 research papers. He's the consultant at BrainX AI, and he's the founding member and educator of DoctorsAI. So welcome, sir. Over to you now. You may share your screen now.
Thank you. Thank you so much. And I was just listening to the wonderful collaborations that have happened to make this event possible. And I would like to congratulate all of you for taking this initiative by the name of OncoQuest and for inviting me. I'm really honored to be here, and I'll just share a short keynote. I know we are already running late because of technical issues. So I'll not take a lot of time, but I'll give you a brief overview of how we should look at AI in healthcare. Let me share my screen now. So I think you need to stop sharing your screen. Good. So just let me know if you can see my screen.
Yes, sir.
Great. So as already introduced by Mansi, I'm Dr. Avneesh, and I'm here to talk to you about a field that I'm quite passionate about, which is AI in healthcare. And I was very excited when I was approached for a keynote by Mansi, and it's really a great honor to be here once again. I'm representing a community called DoctorsAI, which is now a not-for-profit entity registered as a Section 8 company, and we are expanding now. Our main area of work is AI for medical education and research in AI in healthcare. So I'll give you a brief overview towards the end of my keynote so that you come to know about the organization, which is something new. Uh, this has been my participation. So why are we talking about this topic? Actually, when Mansi approached me, we thought about what we should discuss about, and I thought that challenges and opportunities is a way of like the best way to look at AI in healthcare, because both these things are there in combination, and I think both these things need to be solved for realizing this dream of AI in healthcare. First of all of us on this call are very much aware that rapid AI advancements are shaping our clinical practice. There's improved diagnostics and operational efficiency. There's a huge promise for personalized care opportunities, which is again a very important part of cancer care, because every patient with cancer is different. The disease might be the same, but then the patients are different and need personalized care. And finally, addressing those challenges once we know them is crucial for realizing the true benefits of AI. Like one there's a promise of AI, and one there is the actual true realization of that promise of AI. So there's a huge gap right now between the two, and this is where I see the initiatives like this, which you have taken in form of OncoQuest and our initiative like DoctorsAI. They're trying to fill those gaps and to make the translation of research possible. So this is just a snapshot of challenges. It's not comprehensive, but then you can maybe group them into 4 categories. The most important one is ethical and privacy related challenge. With more and more data becoming digitized, more and more things going into the electronic medical record and connected to the internet, there's a lot of privacy related challenges, cybersecurity issues. At the same time, along with promoting transparency. So there's a fine balance which has to be achieved between promoting transparency and to safeguard the patient information. Because imagine the cancer patient has a lot of medical records, and many of those records are quite sensitive. And if they go out in public, or maybe if they go to the employer, for example, or to the insurance company, they might get misused in some way, which we don't realize. So this is a big challenge which we need to realize as developers of AI. And whoever participants are in this challenge, I would tell them to be really means very much concerned about this particular challenge, which is ethics. Because in healthcare it is different from other industries. In healthcare we have the dictum of first do no harm, which is not quite similar than other industries. So that is why ethics are quite important to our field. They're very close to our heart. Second, there's lack of awareness. Most of the doctors, in fact, don't know about AI, what AI actually is, what it can do, and what it cannot. So that is another big challenge which I want to highlight. And a lot of initiatives are taking shape in addressing this challenge, including DoctorsAI, and I also heard about Edge Spectrum. So all these initiatives, I think, will go a long way in promoting awareness about AI technologies among different stakeholders. Third one is unreliability and trustworthiness. Generative AI is quite awesome, but then sometimes it throws out hallucinations or wrong facts, which in healthcare can be quite damaging, because healthcare is a field which is based on trust and correct knowledge, and giving correct knowledge at the correct time without causing any harm. So unless AI and whatever tools, generative AI, non-generative AI, unless they fulfill this sort of a trustworthiness gap, I think they're not going to see any adoption on ground among real clinicians. Because when I talk to clinicians, I have been a clinician myself, so the main concern is I have to recheck the information. I have to recheck everything that AI gives me, and it just increases my work. It takes a lot of my bandwidth. I don't know how many of us enjoy checking papers of students, the answer papers. So it's like a rote task, like, so it's very difficult. So we need to understand that we need to create AI which is trustworthy and reliable to become adoptable. So all these challenges, I'm talking from a general point of view, but then all these apply to cancer care. Cancer is not something which is different from the other fields of medicine. I think every specialty, every super specialty in medicine has this sort of challenges when they're looking at AI adoption, including cancer care. And finally, in this era of consumerism, I think there's a lot of debate around professional liability. What if AI makes a mistake and it causes harm to the patient. And then who is responsible? Am I responsible as a developer of the AI tool, or am I responsible as a doctor who trusted the AI tool and applied the prediction, or it is the patient who is responsible because they give the consent for using AI? So this is a very complex question and it's quite challenging. There can be different viewpoints. I think we need to have a lot of discussions around these challenges in every sort of meeting that we have, so that we are able to figure out pathways to address these challenges one by one. And how you can do that, first and most important, is privacy safeguards. I know we have a lot of engineers today, so I think talking is easier than doing. But then again, I would say that unless we have robust security measures, AI is not going to fulfill its promise in healthcare. Especially, there are a lot of bad actors out there. We are hearing news about hacking and all those ransomware attacks and all those things, and even a small news makes people working in healthcare quite risk averse as clinicians from using the tool, because we have faced a lot of flack from the society and our patients for making small mistakes. So we don't want to take any extra like legal liability of sort of using AI. So I think that should be the first principle of making AI secure and reliable and trustworthy, to make it adoptable in healthcare. Second is education programs. We need to increase AI awareness both for doctors and the public. And third is collaborative development. AI, someone told me, is a team sport. You cannot build AI alone or adopt it alone. You need an entire team of experts who have to come together and do the design. And this event is a great example of such a collaborative development effort. And finally, we need to establish ethical frameworks. As I told you, unless there are ethical frameworks around use of AI in healthcare specifically, it is going to create a lot of hype and a lot of media headlines, but then you will see the same thing happening in your hospital ward day in and day out. Many medical students on this call, they must be seeing that the difference between the talk that is going on about AI and the actual thing that is happening on the patient bedside. I think those who have worked in medicine realize the contrast that I'm talking about. But then it all is not doom and gloom. There's a lot of opportunities of AI in healthcare, and that is why we all are motivated and wake up every day and do what we are doing. Is because there are a lot of opportunities in these areas, right from diagnosis and patient monitoring to drug development. We can get faster medicine, especially in cancer, where there are a lot of candidates for therapies like immunotherapy, and you want even personalized treatments for particular patients, or you want to enroll patients faster in clinical trials. So all those places, AI can help in improving the process, making it more efficient, reducing the cost, creating virtual health assistants, because doctors can, of course, doctors are the best person to be at the side of the patient when they really need empathy, actual empathy. But then they also have limitations. They cannot be available 24/7. So that is another huge area of opportunity in healthcare, especially cancer care. We can create some virtual health assistants which can provide care in the absence of human doctors or in between the visits. Another area where AI has a huge opportunity is improving the teamwork and decision making. So whenever you have huge teams, there's a lot of amount of data which is coming into the system, and then there are a lot of need to happen. And nowadays, with more and more data and more and more decisions happening in per unit of time, I think you need some sort of a technology to fasten that process and make it more reliable. So I don't see any other technology as of now other than AI which can help us in doing so, because no matter how many humans you hire and how many brains you build as a collective mastermind, but then the speed at which AI can do things is like something which we cannot match, and we should not match. Why we should match? We should complement each other in a way. Human AI collaboration should happen. So these are the opportunities. The idea is to just give you a screen like a landscape view overview. Each topic in this healthcare, which is moving from evidence-based medicine. So a lot of students on this call are from research background. So it's great to have research which is evidence-based, and the way we have been doing research from times like maybe last 100, 200 years. But now I think the time is to move from this evidence-based medicine to the data-driven, intelligence-based precision medicine. We are getting a lot of data in real time. I think we need to change the way research is done. I think more research needs to happen in real time. And with generative AI tools, I think we have wonderful ways to collect information and process it into insights. Only the reliability piece is missing, but I think that is improving with time. So I think there's no reason why we cannot move from this evidence-based medicine to the larger part of iceberg, which is submerged, which is intelligence-based medicine. And I hope I'm not sure, but I hope maybe the cure lies there. Right now we are just managing conditions, but then let us try to see if the cure lies under the surface. So AI will help us in seeing what we have been missing. This is my perspective on AI, and I hope many of you will agree with me on this. Finally, a few words about multidisciplinary collaboration, because I was told to talk a bit about on this, because this is a event which is having both doctors and non-doctors. This is what it takes to build ethical AI solutions. It's not just a single person, a patient or a doctor or an engineer. It takes views from all these people, and you can see how many stakeholders or multidisciplinary collaborations need to happen to develop good ethical AI solutions in healthcare. And that is where a paper suggested like a concept of multidisciplinary conferences. So in this, what you can see is that multiple disciplines come together, and then they develop explainable AI, which is explainable to all the stakeholders. And once those interpretable AI solutions are deployed, they improve patient outcomes. So this is the power of interdisciplinary learning, and these are the different best practices which you should follow when you are developing interdisciplinary learning, which is you should clarify the roles. There should be effective leadership. Like if you have a team but there's no leader, then I think it is quite ineffective. So, but then if you have a leader, there should be equal like respect and equitability also. The doctor should not look down upon the technical people, and the technical people should not look down upon the doctors, because they all have been trained differently. They have been trained in a different environment. They have different strengths and different weaknesses. I think they should work in a complementary manner. And this is what we always advocate as a part of our group, which is DoctorsAI as well. So next steps, I think, would be more policy development. I think more and more policy should be made clear. There's a lot of gray area around this topic. That is why a lot of adoption is lacking. Even if you build a good tool, there's no regulatory environment like around it. And where do you go with the device? Who certifies the device? How do you enter into the market? So all those things are quite murky. So that needs to be clear. Then you should also have pilot programs. Don't implement AI in a way like just make the news headline. Okay, from tomorrow the AI will be applied for cancer care in this hospital. This is not going to serve any sustainable purpose in the long run. Instead, you should run shadow AI in the background, run pilot programs, see if it is creating real benefit, and then only implement it in a wider setting, because adoption is a very key thing. If you are doing a startup in healthcare, if you don't get adoption, your startup will die out. That is as simple as it is. And finally, continuous education. I think if you are investing in an AI solution, you are building an AI solution, but you are not investing in AI education of your stakeholders, I think then you are just wasting your money. So if you are building something, also work on continuous education of your end users and adopters. So key takeaways. AI has a transformative potential. We all realize and we know this. And with each passing day, we are realizing this more and more. Ethical considerations are crucial in healthcare, especially. It is not like other industries where you can just put out a solution and then say sorry for the mistake that happened. Collaborative approach is important to involve all stakeholders in AI implementation. And there should be ongoing research even after implementation, because sometimes what happens is the AI looks very good on the paper, but once you apply it on ground, it doesn't do what it is meant to do. We have a lot of examples around this. So last few minutes, I'll just take to introduce my community called DoctorsAI. We started a WhatsApp. community of 50 to 100 people. And now today we have 1,200 medical professionals in our WhatsApp community. We have around 2,000 people in our LinkedIn community. And we have around 1,000 plus subscribers of our newsletter. So we have 1 year of our existence as of now. This is our website. And we see that the future of AI enhanced medicine should be powered by medical leadership and innovation. Of course, it should be a team sport, but then any AI in healthcare should not come out without medical input or having clinicians on the table. I think this is the vision with which we started, and we do a lot of activities. You can join us on these channels. This is our website, and I'm one of the founder members. We have a student wing as well, and we have a journal club, research wing. So we do a lot of activities. This is the activities which we do. We have a podcast as well. And we held a summit, global summit, last December. So we are having again in this December. I would invite all of you to join it. This is the first book which we have released, Decoding AI for Physicians. And we also have started a certificate course on AI in medicine for medical professionals. We have already completed half of our first batch, and we are registering people for the next batch as well. So this is some of our activities. This is the community where you can join, whether you're a doctor or non-doctor. On LinkedIn, we invite all of you. So that's all from my side. And thank you for your time. You can connect with me if you want for more insights, and I would be happy to spend time with you during this OncoQuest. Thank you so much. Back to the organizers.
Yes, sir. Thank you, Dr. Avneesh. So there's a query from Karthik that it's in the chat box. Sir, any advice on how we can incorporate using AI while studying our medical curriculum and undergraduate research projects?
So there's not like one way. There are multiple ways. You can start right from your medical education itself. Look at the way how you are doing your medical education right now. Is that the efficient way to do it, or you can incorporate some AI tools into your workflow? Maybe tools like Google Notebook LM or ChatGPT. These are the most low-hanging fruits available out there right now. But if you want to go into more medicine focused tools, there's something called as glass.health, which helps you in formulating the patient treatment plans and all. So there are a lot of tools out there. My advice would be to first do one of the basic courses on AI in healthcare. Try to learn it from people who are actually using it, who are doing it. There are some hands-on workshops also which we conduct, where we get you started right after that 6 hours of spending time with us. We get you started on using AI, of course, while studying your medical curriculum and undergraduate research projects. We have a lot of students with us who have written entire papers, who have built some custom GPTs, who have done a lot of projects just after completing that workshop. So this is the most basic advice, but I think it is very difficult to answer this question in a few minutes of time. Maybe if you come and join our activities, you'll get more insights on this.
Okay, thank you, sir. And moving ahead, so about the most awaited part, that is round 1 results declaration. So we have shortlisted 12 teams, and out of which we have Hippocratic Techies, Third Eye, YEMS, OncoBud, Neo Pioneers, Onco Analytics, Cure Crusaders, Tech Bytes, Cloverdale, Medicode, Ash, Deep Cure. So these 12 teams have been qualified for the next round, that is round 2. And all the details and guidelines will be shared to you guys. And the results are now live at Unstop. Yeah. Thank you, Dr. Avneesh. It was really insightful. We hope everyone learned so many things from this session. And thanks for having you. Thank you, sir.
Thank you so much, sir.
Thank you, everyone, for joining.
Thank you. Bye. Good night.
Thank you.